Hello, and welcome to This is Normal, a podcast where we normalize the conversation on women's health. I'm your host, Lena.
And I'm Cece. Today we're going to cover some specific struggles girls face when learning about their own bodies.
So, let's start with the basics. Why are we trying to normalize women's health education?
Well, for years this topic has been considered niche or taboo, and while it's not considered as disgusting or disrespectful to talk about now as it may have been in the past, it's grown into an uncomfortable conversation for many.
The negative connotations that women's health has been given can be linked to the long history of systematic patriarchy that society is still trying to overcome. For example, before the 1990s, when Congress passed a law requiring women to be included in clinical research, the U.S. frequently avoided and even prevented testing on women.
This was due to the fact that women have been historically deemed the primary caregivers of their households, meaning that they wouldn't have time for research trials, and men became the default research subjects, making their bodies the standard.
Yeah, and not only that, but since so little research was being done with women, many health experts hadn't even considered that there would be such a vast healthcare difference between genders. Over time, that avoidance of women has made it more difficult to find and provide them with proper education.
We're trying to normalize women's health so that it's no longer difficult to educate the people in our societies. We want comfortable, open conversations because when women don't have access to such information, there are higher rates of preventable disease, delayed diagnoses, missed opportunities for early intervention, and simply unfair confusion.
The lack of education does not only affect women, but it influences their families, communities, and healthcare systems as a whole. If we are able to have these tough conversations now, our societies will begin to grow, helping future generations to come.
To get into the understanding of the education gap, one of the most glaring issues is how underinformed women are on the basics of their bodies, including menstrual health, reproductive anatomy, or signs of common health issues. If they're unfamiliar with their basic biological health, it's possible that when something is wrong, they won't be able to identify it until too late.
Not only that, but often as women do seek medical care, they are brushed off and not taken seriously. Their pain is more likely to be minimized, and because of the research gap in clinical health, women's symptoms are often misdiagnosed, especially women of color.
The underrepresentation of women in studies for basic treatments can even be dangerous, leading to, as mentioned previously, misdiagnoses, ineffective treatments, and a general mistrust of a system that continuously fails to listen to them.
Women's health is more than menstrual and reproductive health. Due to there being true anatomical differences between male and female bodies, clinical health issues that are faced by both sexes may present themselves differently. For example, heart attacks in men can be identified by the clutching of a chest, demonstrating immense pain, while in women, the symptoms present much less severely, with signs such as fatigue, dizziness, prolonged discomfort, and sweating. The lack of knowledge creates fear and confusion, which discourages women from seeking help when they need it most.
Trust in the system often differs demographically. During our interview with Rachel Bednar, a women's health practitioner, she explained how the systematic bias plays out across all levels, from policy and funding, even into her office.
Missouri teaches an abstinence-only program, so Missouri public schools only get the education given to them by Missouri, and they do not have the option to opt in or out. So they can't choose a different, even if it costs money or free, a different option. Private schools have the ability to choose whatever they want. So I would say, generally socioeconomic status makes a difference there. People who are lower socioeconomic status tell me more about their sexual history, request testing and request screening and birth control, versus a higher socioeconomic status are there for me to tell them what to do and are usually there with their mom in the waiting room, and I'm encouraging them to get those things because they don't know they should. Because it is not talked about.
So, where does all of this actually begin? Most of the time, it starts right at home or in the classroom, where adults oftentimes avoid talking about things like our bodies, sexuality, or even just basic health. And it sends a message, whether intentionally or not, that these topics are shameful or not okay to discuss. And as a result, a lot of girls grow up feeling unsure, confused, or even embarrassed about what's happening with their bodies.
In many public schools around the United States, the required sex ed program skips over several important topics necessary to inform young girls about their bodies and often fails to prepare them for real life. It skips over key details, simple as noticing if something's wrong with your health, like having an STD, or how to ask doctors the right questions, or even how to understand the changes your body is naturally going through during puberty, menopause, and beyond.
And to be clear, this isn't just a problem with sex education. Regardless of what people are being taught, they often still lack basic health knowledge. Stuff like how hormones affect your mood and your body, what symptoms are totally normal versus ones that may need medical attention, and how to speak up when something doesn't feel right in your body, which is important for everyone, not just girls.
And there are other barriers that make all of this even harder. Things like poverty, living far from doctors or clinics, going to a school that doesn't offer culturally respectful or inclusive lessons. If you're growing up in a community that struggles with stuff like this, just getting to access accurate information can feel almost impossible.
Then there's the generational gap. A lot of our moms, grandmothers, and older relatives didn't get this information either. Back then, no one really talked about it, and that silence kept getting passed down, almost like an invisible rule that says, we don't talk about these things. But that cycle can and should be broken.
And that's why community is so important. Real change happens when we create safe spaces to talk, whether it's between moms and daughters, friends at school, or teachers and students. The more we normalize conversations about women's health and wellness, the easier it becomes to treat it just like any other part of life, like eating healthy or staying active.
So, what can we actually do about all of this? Well, the first step is simple. Just talk about it. Start conversations with your friends, your family, even your teachers. The more we talk about our experiences and ask questions, the less awkward it becomes. Openness makes a huge difference in the overall acceptance of talking about women's health.
Next, learn. Take time to educate yourself. There are tons of reliable sources out there, such as Society for Women's Health Research, that explain health topics in ways that actually make sense. With the access to the internet we have today, it is important to find credible sources which do not always include social media. Don't be afraid to question old ideas, or speak up if something doesn't seem right. And if your school's health class is outdated or incomplete, push for change. Ask for better.
And on the topic of advocating, use your voice, even if it feels small. You can support policies that focus on better health education, talk to local leaders, or even vote when you're old enough. Change doesn't just happen. It needs people like us to make it happen.
We hope today's episode encourages you to talk to those you know and bring these issues to light, because silence prevents change.
And with the power of being informed, we can work towards positive changes and a more open-minded and informed society, because this
is normal.